Hi, welcome to week 6 of the book club. Wait, week 5 or week 6?
One of those.
One of those. And
Week 5 to 6 of the
week
book
5 to 6.
club.
We're discussing the last 2 chapters of the book and our conclusions and sort of just our takeaways from the book as a whole.
Yeah, so these last two ones, one is sort of like, where's the US and Canada at now? Now being when the book was published in 2008 or 9 or something, so it's not like now. It was all before the Affordable Care Act. And then the last one is sort of lessons and conclusions, and I think we're mostly not going to review the book, these chapters like we usually do. We're going to talk about our own answers to those questions. So we had 3 questions that we're going to talk about, and we'd love to hear what you all thought. Number 1 is, what today, right now, as we read this book, is standing in the way of winning single-payer healthcare in the U.S., and what is the role of the politics of race today? And second, what sort of bodes well for single-payer? And this is something Boychuk also starts to get into. Obviously, there's a lot of things very different today than there were that were the barriers to national health reform back when Truman and LBJ were trying to win it. So what's sort of improved? What opportunities now are there for passing national health insurance in the U.S.? And lastly, what are the implications for us as organizers? So those are our 3 questions. Let's start with number 1. What do you think? I think we started this whole thing off with what are the most common explanations we hear for why there's not national health care in the U.S.? So what do we think now, today, is really standing in the way of single payer?
Right.
And is it race, or is it other things, or all of the above?
Sure. When Medicare was being passed, Boychuk makes a very good argument that race was a huge reason, and it was in particular against blacks, and particularly the South, that didn't want to have integrated facilities. Today, obviously, the landscape is very different. I think we still have discrimination against minorities, obviously with Latinos and the undocumented. And so I feel like the work done to recognize the right to healthcare as a human right and not just a right of citizenship is work towards our movement today. So one of the things that would definitely be standing in the way is the right to health as a human right. But I guess one other thing is the insurance companies and their influence, which was not present when Truman was trying to pass national health insurance, and our horrible representation by our elected officials. I think that, campaign finance money or insurance company money all over Congress is probably a big obstacle.
This has kind of been a recurring theme for us, that the healthcare industry is now much bigger than it used to be, even 20 years ago, because for-profits have sort of grown up in that period of time, for-profit delivery system. But I think I agree. I think the politics of race is still a major barrier, but in different ways than it was when protecting segregation was the way that protecting race was. And when we were sort of talking about this before jumping on camera, I had asked you, one way of thinking about what is standing in the way of single payer today. Another way of phrasing that question is, why did 19 states refuse to expand Medicaid when it was free? And a lot of those states are exactly the same states that were blocking national health insurance to protect segregation. So it's obviously the stakes are different and the reasons are different, but it's the same exact states. And if we ask ourselves honestly, is the politics of race a really predominant reason that those 19 states did not expand Medicaid? I mean, the answer is obviously yes. There was a really good write-up of the fight over the expansion of Medicaid in Mississippi that was written by Sarah Varney in Politico. You should check it out. It's called Mississippi Burned. And it is really obvious how the overwhelmingly white-led Tea Party governor of Mississippi, just how the politics of race loomed very large in that decision not to expand Medicaid. And I think we could say the same about almost all those other 18 states. So I think that is still with us. We still have that general political system that he was talking about in the 60s. It's just not protecting segregation right now.
it's kind of been converted into the language of rights,
Right.
Versus
States' rights, which was created
states' rights.
back in that period.
Yeah, and also, I mean, individual rights, the
Mhm.
right to be free of taxation,
Right.
to be free of paying for other people's.
Right. Very important fundamental human right,
Yes.
not to pay for other people's health care. So I think, yeah, I mean, I'm still sort of turning this over in my mind, but I think today the politics of race still looms extremely large in our healthcare system, but also just in general in American exceptionalism, why we don't have these broad social protections at the national level. And when you dig into some particular states, but that doesn't explain, of course, why universal healthcare hasn't been passed in other states at the state level. I think that's a more complicated question that we haven't really dug into as much here. All right, so let's talk a little bit then again about what bodes well for the movement. What's changed that sort of opens up opportunities for winning national health insurance today that maybe we didn't have 20 years ago or 50 or 60 years ago. Any thoughts on that one?
Well, unlike at the time when again Truman was trying to pass national health reform, covering everybody today could be done with the same pot of money that we're already sort of spending. It wouldn't that we'd have to raise new revenue. To do that, we would just have to convert private spending into public spending. Mm-hmm. So that I think is actually. Although many would say that, there's already a lot of private insurance, people are already covered under private insurance plans, that this could actually go both ways. It can also be seen as a boon for our movement because,
yeah, I mean, it's like the flip side of the coin. We have this huge healthcare industry that we have to fight against, but also that's all of our money that we're currently spending. That unlike if you have a very low commitment of healthcare spending in the country and you implement national health insurance, suddenly you're really paying a huge bill for it. We can essentially get universal healthcare for free. We're already paying for it. So I agree with that one. I would add, when you think about the role that the primary sort of, I hesitate to call it grassroots, but grassroots opposition back then in the earlier narratives was the American Medical Association. They led every charge to oppose national health care. Today, a majority of doctors now support single-payer healthcare largely because of the work of PNHP, grassroots organizing work. So that, I think, is a big changed opportunity. Obviously, we don't have segregation. I think that's actually a very important change that facilitates passing national health insurance. So I think and I think Wojciech seems to agree with this too, that there's nothing worse now blocking, the passage of national health insurance than there was decades ago, and there's definitely new openings for it.
Yeah, and so many are dissatisfied with the Affordable Care Act on both sides of the spectrum. So, and that in fact the ACA polls worse than single payer does in recent and not even that recent polls, and yet the ACA was the thing that passed.
Right. Yeah.
Curious.
Healthcare. You would think that healthcare would disappear as an issue after you passed health reform.
Yeah.
But it was so inadequate to the actual suffering inflicted by the healthcare system and I think that's another thing is costs are also, we're paying a lot, but that is also, healthcare costs are edging out everything else. Mm-hmm. So the federal government is losing its ability to pay for other basic social services because their healthcare spending is going up. Here in Massachusetts, healthcare spending is about half of the state budget. So, spending on education has plummeted, spending on local aid has plummeted. That's happening in states across the country. Same with the municipalities, same with businesses, same with households. It's like, are we going to pay for healthcare? Are we going to pay for food and shelter? So I think the crisis has reached, the costs have gotten so high that the crisis, sadly, I mean, this is not how you want to win a social movement, and it's not enough to win a social movement, but the crisis has become really acute. I think it has not gone away by fake attempts at reform. So, all right. So why don't we wrap it up with sort of implications for organizing for our movement? Any final thoughts? And that probably builds on what we were just talking about. I mean, I think for me, some of the implications for organizing is that trying to win national health insurance, we are not in a silo. We're not just fighting for healthcare reform. The biggest things that are obstacles to us winning are sort of having to do with the whole political system. that affects all attempts to win social policy at a national and a state level. So I think we're sort of in a boat with a lot of other social movements. Is one sort of implication for me to be a little less siloed in our organizing.
So some people think that our movement needs to focus on healthcare as a human right, and that's how we're going to win single payer. And some people think we really need to focus on economics and like the financial impact of having private insurance be the main source of insurance for working age people. I think that the discussion that we just had points to the role of both. That we need to talk about why single payer is both the more economically responsible choice, because we are spending, pointing out that we are spending this crazy amount of money that other countries aren't spending, as well as the fact that because of the undocumented population here, we're going to have to of course, to cover them as well, and the right to healthcare as like a human right and not just a right of citizenship needs also to be made that case. So to get single payer. So yeah, I think that's
and maybe we should talk about racism.
Yeah.
In our movement is another lesson from the book. Not only the history of racism, but today the role that the politics of race play and why that's behind some of the attempts to stop national health insurance, universal health care from passing. And I think, the other thing that's very different from the 60s is that racism now involves immigration to a much greater extent. And the Latino and Latina population in the US is driving changes in the political system. It is driving, it's given a different shape to racism, I think. And I think the immigrant population has inherited a lot of the structures of racial inequity that were created around African American residents too. So that's also different, I think, the way we have to interact with the immigrant rights movement as well. Any other thoughts? All right, you guys tell us your thoughts. And I think next week we're going to get to have like a little conversation with the author, which is pretty cool. So, all right, and you can tell us your questions that you have for the author as well. All right.